Good morning, everybody. Thank you so much for being here. I'm honestly very honored to be here for this conference. I think the theme is very relevant. The one thing that I particularly focused on from the Dean's introduction was the point that the people who really should be here are not here, so it's incumbent on everybody here to do what they can. And I've tried to do that in my own practice to try to expand access to healthcare discrimination. What I do most of my time at my law firm is not this. It is complex commercial litigation, which is another way of saying I help companies sue other companies, particularly in the pharmaceutical space. I defend against those kinds of suits. But I'm lucky to be at a firm that is also focused on advocacy and pro bono work, and through that I've been able to really reach out to the community, particularly the LGBTQIA community, and focus on the people who are the most underserved and the most marginalized. As Anders said, I'm going to trial in 2 months, at the beginning of April actually, so less than 2 months now, to defend the right of transgender inmates to receive hormone therapy while they're in prison. And that is a particularly underserved and marginalized community because if you're a transgender inmate, you have no rights right now. And so that's something that sort of led me to this whole idea of access to healthcare. And while there are particular communities that don't get any rights, I thought when I started into this space, we must have protections in general for people outside of a prison environment to get access to healthcare. And the one thing I'm a little worried about today is that this is going to end up being a very depressing presentation for a lot of people. It may be, it should depress us how vulnerable these rights really are. During the Obama administration, I felt very strongly that things were moving in the right direction, and it was devastating to me, as I'm sure it was to many people in this room, when President Trump was elected, and it just seemed like everything turned on a dime. And so that's one thing that we're going to be talking about a little bit today, how truly vulnerable these protections are and how they're moving in a direction that we need to do everything we can actively to fight against. So there's two questions that really I wanted to examine today. The first is, do LGBTQIA individuals have a legal right to be free from discrimination in their access to health care? And second, do LGBTQIA workers have a legal right to be free from discrimination in their workplace? The answer to both of those questions, as I'm sure many of the people in this room would agree, should be yes. Unfortunately, the actual answer is, it depends. So to sort of ground the conversation, I thought it would be useful to talk about what healthcare discrimination actually looks like. So I have 3 examples that I'll go through quickly. They are real examples pulled from the headlines. They're things that actually happened. I'm sure they are not unusual. I'm sure these things happen all the time. I know from speaking to my own clients that they happen all the time. And they are also obvious examples of healthcare discrimination. In reality, healthcare discrimination takes all kinds of forms, and some of it is very, very, very subtle. It's not somebody saying, I'm not going to treat you because you're gay, or I'm not going to treat you because you're transgendered. It's a doctor or an institution having an attitudinal difference towards people from that community. And that's really hard to fight against because the law is sometimes a sledgehammer, and it can only deal with the things that it's absolutely able to see and prove. And that kind of healthcare discrimination is really, really difficult to prove. And the way to fight against it is to start to change attitudes. But we're going to play a little game that lawyers love to play, which is this legal? This is a real case. In Indiana, a transgender woman went to a hospital. She had just moved to the area. She had previously been receiving hormone therapy. She had valid prescriptions for the hormone therapy that she wanted to continue. She also wanted counseling from the hospital. The hospital had the ability to provide all of those services. They said to her very clearly, I'm sorry, mister, they said. We don't treat transgender people at this hospital. We have the ability to do it, but we're not going to treat you. We just, as a category, we don't treat people who identify as the gender they are not. Who here thinks that that's legal? I feel like people are grumbling about Indiana. They're like, Indiana. Who thinks that's illegal? Yes. Guess what? The legals have it. absolutely legal in Indiana. And the reason is there's no federal law that protects transgender people and their access to healthcare discrimination. And Indiana, the birthplace of the Klan, is not a place where they have any state laws that protect that kind of access either. So this happened, somebody brought it to the press, attempted to bring suit, and was told, I'm sorry, there's nothing we can do about that. You need to find another hospital. And that's a theme that we hear all the time from people, that the doctors and institutions, and earlier the insurers would say, okay, this person doesn't want to treat you, go find someone who will. And that's fine, maybe, in a metropolitan area where you can say, forget you, I don't want to deal with you anyway, I'm going to go to find another doctor or another institution that will treat me. That is not the case in wide swaths of this community where there might be one hospital or one provider who does a particular type of service. If they say they're not going to treat you, you might not have any other recourse. So that's always something that, when we live, I'm from New York City, I live in spitting distance of 100 hospitals that will do this kind of treatment. California has a lot of institutions. That is not the case in Indiana, and it was certainly not the case where this person was going to the hospital. So the point is, they just didn't get treatment at all. In order to get that treatment, they would have had to go miles and miles and miles in a way they couldn't do. And so the reaction was, you have no recourse and there's nowhere that you can go. But nothing that the law could do about that. This is another case in New Jersey. There was a patient who was HIV positive. He was admitted to the hospital for a related condition. He revealed to hospital staff that he was HIV positive and that he was gay. And when the staff found that out, they essentially started ignoring him. They wouldn't give him his HIV medication. He missed 5 doses. I'm not a doctor, but my understanding from speaking to people is that if you miss 5 doses of an HIV medication, it can make that medication significantly less effective. It can even, in some cases, make it ineffective. He appealed to his own personal doctor to call the hospital and say he needs this medication. Doctor called them, and the hospital said, we're a Catholic hospital. This is what happens for going against God's will. And when he leaves, he can start taking his medication. And they also said to the doctor, you must be gay too if you're his doctor. Who thinks that's legal? Some cynical people in this crowd. Who thinks that's illegal? You're right, it is illegal, but the reason why it's illegal is a little bit interesting. First of all, New Jersey just happens to be one of the states that has anti-discrimination laws that protect people from healthcare discrimination on the basis of sexual orientation. There are many states, as we just mentioned, that don't. So this man was able to sue in New Jersey under the anti-discrimination laws. They ended up settling out of court. Second, what he could have done is sue for malpractice, because this is malpractice. The standard for malpractice is if there's a standard of care and you're not meeting it, then it's malpractice. And it doesn't matter why. So if he had sued for malpractice, the fact that they said to his doctor, this is what he gets, this is God's will, doesn't matter. It's completely irrelevant from a legal perspective, which is tragic, actually, because that should matter. But in a malpractice case, it doesn't. So he had 2 bases for suing here. But if he had been in any other state, if this guy had been in Indiana, it would have been a case where he was just suing under malpractice. The fact that they said all of these things probably wouldn't even go before a jury because it's technically not relevant. And this one in Michigan, a 6-day-old infant was denied pediatric care because the doctor said, I prayed on it, and I don't think I can treat the baby of lesbian parents. Who thinks that's legal? Who thinks that's illegal? You're wrong. That's completely legal in Michigan. Absolutely legal. There's no federal law at the time that, this was in 2015, no federal law that protected access to health care for lesbian parents, for their children, nothing like that. And there was no state law, and there is no state law in Michigan that protects LGBTQIA access to health care. And it's worth pointing out, the baby's not gay. The baby's not a member of the community. We don't know that yet. It's a 6-day-old infant. It was just the fact that the parents of the baby were gay that led the doctor to deny care, and they had no other recourse except to find another pediatrician. In summary, there is no federal law that protects access to health care. We'll talk a little bit about the Affordable Care Act, because there was a very brief period where that federal law was trying to be cobbled together by the Obama administration. But in general, and as it stands right now, there's no federal law that actually protects your access to health care across the board. So what you have left is a patchwork of state laws. So it depends where you live. If you are in California, this is the best jurisdiction to be in order to safeguard access to healthcare. California has state laws that protect transgender people, that protect on the basis of sexual orientation, that insist on coverage for pre-existing conditions, including gender dysphoria. There are other states, it will not surprise you which ones they are. You know, it's your Texases, your Georgias, your Alabamas, your Mississippis, your even Ohio's. They don't have any laws like that. So you're essentially at the mercy of whichever doctor institution you try to go to. And then there are states somewhere in the middle. And surprisingly, New York, which people think of as a very liberal state, it has some of these protections, but not all. So in New York, there's no protection for transgender people under the law in terms of access to health care, but you can get protection on the basis of your sexual orientation. So you are completely at the mercy of where you live or where you happen to be when bad things happen to you. Now, Obama, bless him, came into this space in 2010 with the Affordable Care Act, and aside from just overhauling essentially the entire healthcare system in what I would say is at least a step in the right direction, they were very focused on protecting access to healthcare for marginalized communities, and LGBTQIA was one of those communities. And the way the ACA did that is two ways, really. The first is prohibiting insurers from denying on the basis of pre-existing conditions. And this was a big deal at the time, and it remains a big deal. People who followed the debate over the repeal and replace of the ACA, that was a sticking point because people loved this across the board. But it was aimed at protecting whole swaths of people, including the LGBTQIA community, because what insurers used to do before was look at you and say, oh, you have a diagnosis of gender dysphoria, you can't get coverage here. That's a pre-existing condition, and we're not going to pay for that. So transgender people as a class were in many, many cases excluded from having any health insurance at all. And in this country, as you know, if you don't have health insurance, you don't have access to health care at all. So the ACA turned that over and said you cannot deny people coverage on the basis of any pre-existing condition, including gender dysphoria, for example. HIV positive status was another thing that disproportionately affects the LGBTQIA community. That was a reason that you wouldn't get coverage, and that's not the case anymore. So those protections remain in place, and they're very, very important. The other thing that was considered revolutionary at the time, and still considered revolutionary, is Section 1557 of the ACA, which bans insurers and any institution that receives federal funding from discrimination on the basis of race, color, national origin, age, disability, or sex. And you'll notice that sex does not explicitly include sexual orientation. There's a reason for that. So sex is what it said. Then the Health and Human Services Department implemented a final rule which was intended to interpret the non-discrimination provisions of the ACA. That went into effect in July 2016, and as we'll see, it was only in effect, in its full effect, for a very, very short period of time. It also applies to, like I said, to any federally funded entity or any insurer participating in the ACA insurance marketplace, which is a huge number of institutions and providers. And it defined sex discrimination to include discrimination on the basis of pregnancy, termination of a pregnancy, childbirth or related medical conditions, sex stereotyping, and gender identity. So right there looking at that, you can see that at least half of this country is furious when they see this for a bunch of reasons. One is termination of a pregnancy. Everybody knows that's a hot button issue here. And also sex stereotyping and gender identity. And it's worth pointing out again, you don't see sexual orientation in this list. And the reason you don't see sexual orientation is because there's no federal appellate, like high court and Supreme Court level case that actually says sexual orientation is protected. So what the Obama administration had to do was they had to sneak it in under the rubric of sex stereotyping. And in order to do that, they relied on a case from 1989, a Supreme Court case called Hopkins v. Price Waterhouse. In that case, there was a woman named Ann Hopkins. She was employed at Price Waterhouse, the accounting firm, and she was up for partner several years in a row. And every year she was told, you know, your work is really great and we would love to make you partner here, but you gotta start dressing more like a woman. You gotta start wearing makeup, You're gonna start wearing heels, dresses. You need to be nicer to people, smile more, all the things that women hate to hear. And she put up with this for a few years and then finally said, this is ridiculous. I deserve this partnership and I'm not getting it because they're discriminating against me. It went all the way up to the Supreme Court, and the Supreme Court, bless them, said this is discrimination under Title VII of the Civil Rights Act, which protects your employment rights, because it's based on sex stereotyping. It's essentially saying, yeah, we'd give you the job, but you need to act more like a woman, look more like a woman. So what the Obama administration tried to do is slip in sexual orientation under there, but it's a little bit shaky because the idea there is animus against people in the LGBTQIA community is based on stereotyping about what a man should look like. So if you don't look like that or act like that, or the very fact that you're a man who sleeps with men, for example, that's a sort of stereotype that you're fighting against. So that was their pitch. And gender identity they just threw in there because they're like, we gotta do this. But there's not a great body of case law that protects you on the basis of gender identity. So they were just asking to be sued here, and that's what ended up happening. So essentially what this rule meant is that if you're a doctor institution that regularly performs a procedure in one context, you can't decide that you're not providing it to someone in another context. And the thing that really, really, really upset particularly the religious right is the idea that if you're a doctor or a hospital that performs a D&C for someone who's had a miscarriage, you have to provide that procedure for someone who's asking for an abortion. And by the same token, if you are an institution or a doctor who provides hysterectomies when that's medically indicated, if you have a transgender patient who gets a diagnosis of gender dysphoria and they ultimately want the hysterectomy, that you have to provide the hysterectomy. You couldn't say, I'm gonna give you this procedure in one context, but not in another. That also applied to insurers in the ACA insurance marketplace. So if you were an insurer and you provided coverage for a D&C or a hysterectomy or any other type of procedure in one context, you had to provide that coverage in another. So it's essentially forcing insurers to provide treatment for gender dysphoria, to provide treatment for, to provide abortions. So I think everybody knows how that's gonna go. So the key statute here is the Religious Freedom Restoration Act, which ends up butting heads with the ACA immediately. The Religious Freedom Restoration Act was passed under Bill Clinton in 1993. It was a nearly unanimous Congress because that was the world we were living in at the time. It prohibits the federal government from substantially burdening religious exercise without compelling justification. What does that mean? Almost anything. It depends on the case, it depends on the court. I mean, you read those words and they're really, really open to interpretation as to what religious exercise is and what would be a burden on religious exercise. And this is an act that people might know from the Hobby Lobby case, which was a very recent Supreme Court case. I hope people in the room are familiar with it, where Hobby Lobby, a for-profit corporation, said, under the ACA, we have to provide contraception coverage that burdens our religious exercise because we are religious and don't believe that we should have to provide that coverage. Contraception is a sin. And it went all the way up to the Supreme Court, very divided Supreme Court, 5-4, found that they had the right to do that, and that the ACA forcing anybody to provide contraception coverage in violation of their own religious feelings about that violated the Religious Freedom Restoration Act. So not my favorite act. So what ends up happening is 3 religious institutions, hospitals, Catholic hospitals, and 5 states brought suit against the HHS final rule implementing the non-discrimination provisions. And they brought it in Texas. Why did they bring it in Texas? Because Texas is one of the most conservative jurisdictions in the country. It's the same way that when Trump entered his travel ban, the suits got brought in California, in Washington, in Hawaii, because those are the most liberal jurisdictions. So people think about where to bring suits to get the results that they want. And that's another thing we'll talk about in a minute, stacking the courts and how that changes how our laws are actually implemented. So here they brought the case in Texas, and their pitch to the court was, this violates our religious freedom because the law is now requiring us to provide coverage for abortions and for for icky gay people and transgender people who want these procedures that we are not prepared to give because we don't like that community. And the court ruled that, yes, the final rule violated the Religious Freedom Restoration Act because it interpreted sex discrimination to include gender identity and termination of pregnancy, and those things were a burden on their religious exercise. So at the end of December, just a few months after the rule was issued, the court issued a preliminary injunction. And what that means is not that the whole case is decided, but it means for now, we've decided that there would be irreparable harm to these religious communities if they were forced to provide these procedures. And because irreparable harm means harms that can't be repaired, so we need to do something now to stop this rule from going into effect. If we let it go into effect while we decide the merits of this case, too many people in the religious community will be harmed. So to protect those people, we've decided that not that it definitely violates the Religious Freedom Restoration Act, but that very likely it violates the Religious Freedom Restoration Act. So for now, to protect these religious communities, we're going to put a nationwide injunction. So right now, this HHS final rule from the ACA cannot be enforced anywhere in the country. So if you are a transgender person and you have experienced discrimination, you cannot go to the courts or any other forum and say, the ACA protects my rights here, because this court has ruled that it doesn't. So right now, there's no protection under that rule. So what can you do? I'm sorry for putting their pictures up. It's tragic for me too. I have to admit, that was to make everybody feel a little bit sick. So the ACLU, who have turned out to be real champions since Trump was elected, they appealed this and said, this is ridiculous, we need to go up to the Fifth Circuit. Are they going to win? I mean, were they going to win? Not really. The Fifth Circuit is one of the most conservative jurisdictions in the country. It covers, Texas and all of those surrounding states. So they were probably not going to win, but they were hoping to kick it up to the Supreme Court. The Justice Department, which under the Obama administration had been fighting this because it's their rule that they are trying now to protect, with this new Justice Department, they said, no, actually, we're fine with this ruling. We're not going to appeal it. So they stepped back. Worse than that, they saw what the ACLU was trying to do, which was get this, like I said, kicked up to the Supreme Court. And so they said to the court, why don't you stay the appeal, meaning put the whole thing on ice, because we're going to go and look at this rule and probably overturn it anyway, so the whole case will become moot. So just leave it. So right now, this is just sort of stagnating. We have this nationwide injunction so that no transgender people are able to benefit from the anti-discrimination provisions of the ACA. And in the meantime, the Justice Department, the Health and Human Services, now under the new guy, Alex Azar, is looking at the rule. And if anybody here thinks that they're going to keep the rule the way it is, they're delusional. The rule is obviously going to change. It's going to take out all of those protections. As they hate the entire ACA. Forget the final rule. So this is where we are. There's a nationwide injunction. It's still in effect. Protection against healthcare discrimination depends entirely on where you live. If you happen to live in a state that protects you, great. If you, and like I said, California is a great place to be for this. If you happen to live in almost any other state in the union, you don't have a lot of protection here. So the last bastion, really, the last place where everybody can look for some kind of help here is to the courts. And even though the courts are the ones that got us in this situation in the Fifth Circuit, everybody is trying to get right now a case up to the Supreme Court that will say that discrimination on the basis of sexual orientation is not okay, that discrimination on the basis of gender identity is not okay. So there's really two ways to do that. There's only two real anti-discrimination laws that are already on the books that we can try to get protection from. One is Title VII of the Civil Rights Act. That's the one that prohibits employment discrimination on the basis of race, color, religion, sex, or national origin. Again, it doesn't say sexual orientation. People have been trying since the 1970s. There have been various amendments brought up since the 1970s to try to include sexual orientation. In particular, they have all failed, and they have all failed by wide margins. So you're never going to get sexual orientation into Title VII, not in this climate, maybe in a few years or a decade or something like that. But right now, what lawyers are dealing with who are trying to protect access to LGBTQIA healthcare is to use the word sex to try to say sex stereotyping, which we already talked about, the Supreme Court found that, but push it a little bit further to say sexual orientation. And we've had some limited success there, but again, it depends on where you live. So in the last couple of years, the Seventh Circuit in Chicago has ruled that it does include protections for sexual discrimination, for sexual orientation discrimination. So if you happen to be in Illinois or one of the surrounding states for the Seventh Circuit, you have that protection under Title VII. On the other hand, the 11th Circuit at around the same time, almost exactly after, and that's the circuit that covers Alabama and Florida, came to the exact opposite conclusion and said Title VII doesn't protect sexual orientation discrimination, which means that if you live in one of those states or many of the other states where it's undecided, if you are an LGBTQIA healthcare worker and someone comes up to you where you work and says, you're fired because you're gay, there is nothing that you can do about that. Under the Obama administration, the Equal Employment Opportunity Commission had been taking these cases of sexual orientation discrimination and deciding them, and that was because the Obama administration Justice Department let them do that. The Trump Justice Department has taken, it will surprise no one, to learn the complete opposite position on this. And they have actually affirmatively put out a paper that says Title VII does not protect you on the basis of sexual orientation. You can be fired by anyone, anywhere because you're gay. Or transgender or anything else under that umbrella. So the only way to get around that is through the courts. And through the courts depends on where you live, because these courts are very divided, they're very political, they're all political appointees in the circuit courts. So where you live will define sort of what protections you get. And Title VII is a big one because it affects a large number of people. The other one is Title IX of the Education Amendments of 1972, and I should say that the ACA final rule depended on both of these. Specifically cited to Title IX, and Title IX essentially prohibits discrimination on the basis of sex in any federally funded education program or activity. So any federally funded school or activity after school program, you can't discriminate on the basis of sex. And it's the same situation where they say sex because they can't say sexual orientation because they don't have a court that says sexual orientation or gender identity. So recently, I hope people followed this case. This was a big one. Lawyers tried to bring this up to the Supreme Court to get the Supreme Court to say gender identity is a protected basis under Title IX. Because if you can get the Supreme Court to say that sex in one statute means sexual orientation or means gender identity, then you can essentially make the argument that it applies under all statutes. So we just need one. We need one win, basically. So this is Gavin Grimm, who is a transgender student who sued the school board over a policy that restricted bathroom use to whatever was your biological gender. And it went up in the Fourth Circuit, which actually upheld his rights and said, this is discrimination on the basis of sex because it has to do with gender identity, which is tied up in this word. And so he's allowed to use the bathroom that corresponds to his gender identity. This policy prohibiting him from doing that is illegal. And it went up to the Supreme Court, and this is exactly what we were hoping would happen, that it would end up getting kicked to the Supreme Court, and the Supreme Court would decide it. It's very dicey in the Supreme Court right now because of the seat that should have been Merrick Garland's and now belongs to Neil Gorsuch. So it's a difficult proposition taking things up to the Supreme Court, but we have to keep trying. So the Supreme Court, it ultimately went up to the Supreme Court, and the Supreme Court declined to hear the case. And one of the reasons they declined to hear the case is because the Trump administration was taking a different view. This whole idea of being able to use the bathroom of your choice was an Obama administration rule. It was a letter that the administration had issued saying that federally funded schools had to allow students to use the bathroom corresponding to their own gender identity. And once that rule was rescinded when the new administration came in, the Supreme Court said, well, what are we basing this case on now? We don't have a letter anymore, so we can't really hear this case. And they kicked it back down. And it was a very sad day for everybody because I, for one, had been hoping against hope that the Supreme Court would hear it and they would do the right thing here. At least they didn't go the other way. And one more, one more terrible thing that's happening right now. And I hope this lights a fire under people. I'm sure people know about all these things happening, but it is horrible to hear about them all in quick succession like this. Very recently, as I was putting together this presentation, the Trump administration topped itself, and they released a proposed new rule, which is now getting comments from people, from various industry and other governmental organizations that are commenting on the rule. The rule proposes a different kind of anti-discrimination protection, because the anti-discrimination protection that the Trump administration is worried about is discrimination against religious healthcare workers. So they proposed this new rule that would protect what they call conscience rights of healthcare workers, which means if you have a conscientious objection on the basis of religion or some other ideology or philosophy to treating a person in the LGBTQIA community, that you should absolutely have the right to do that, because that is your conscience right. Not a term that exists in the legal space right now, but soon will be. And the rule not only protects those conscience rights just as a matter of rules, but they are creating or proposing to create a new conscience and religious freedom division within Health and Human Services. The purpose of that division would solely be to investigate cases of discrimination against religious healthcare workers and to ensure that their rights are protected. So if this rule passes, as it stands right now, because of the nationwide injunction, there are already very, very few protections for LGBTQIA healthcare workers and also individuals who are trying to access healthcare. There is some protection depending on the court that you're in, or the jurisdiction that you're in, or if it's the basis of sex stereotyping. That's still part of the rule. So if you can make an argument that you were discriminated against in your healthcare access because of sex stereotyping, you might be okay depending on the court you go in front of. But now, if this new rule goes in, there's a tension between whose rights get protected. And this is a big battle that happens, we see all the time in this country in particular, of this battle between the religious right and everybody else. And here, they're actually proposing to investigate people who have been discriminated against because they've been forced to provide health care against their will for people in the LGBTQIA community. So this is something that's under comment right now. It's very new. We're not sure what's going to happen with it. Industry groups and non-industry groups are commenting on it. It won't surprise anybody to hear that a lot of the religious groups in this country are very much in support of this, so they're getting a lot of comments in support of it. They're also getting comments from LGBTQIA groups that are obviously not in support of it, and from women's rights groups who are not in support of it. But this rule is very, very likely to pass this sort of notice and comment procedure. It might not end up looking exactly like this. They might scrap this enforcement division idea, but it's very likely to go through the way that it's described in the rule. You know, it's,
I mean, that's the foundation of the country.
Yes, you are absolutely right. There is nominally a separation between church and state in this country. It's enshrined in our Constitution. It's the Establishment Clause. The Fourth Amendment of the Constitution says you cannot make any law affecting the establishment of religion. That does not only protect religions from being discriminated or incriminated against, but also it protects the people from having a religion imposed on them. And you're right, what this is doing, it's another way around this whole issue. And the way they get around it is by saying, well, we're not establishing we're protecting anybody's religion. If you're Muslim and you want to object to treating an LGBTQIA person, that's fine. It doesn't matter what your objection is. We just want to make sure that we're protecting people on both sides of the spectrum. But there's necessarily a tension there. And so what it's going to come down to, honestly, is the courts. And the person who's ultimately, or the court that's ultimately going to have to decide is the Supreme Court. Because it depends what jurisdiction you're in. If this goes up in the Fifth Circuit, this rule is going to get upheld, hands down. I would be shocked if a Texas court has a problem with this. If it comes to the Ninth Circuit, and it will, if this rule gets passed, there will immediately be a California or a Washington challenge to it. In fact, I think California and Washington have already pledged to challenge this rule if it passes. Yeah, you're in a great state. All of a sudden, everyone's like, save us lawyers, it's great. People have never loved lawyers as much as they do now. It's a great time to be alive, except for all of the terrible things that are happening. There's going to be a challenge brought to this rule. If it's the Ninth Circuit, the rule will be struck down for the very reason that you mentioned. If it's the Fifth Circuit, it's going to be upheld under the Religious Freedom Restoration Act. That's what's going to happen. And then it's going to come to the Supreme Court. And this is why it is so important about stacking the courts. And that's what Trump is doing right now. There are tons of vacancies across the circuit courts in the country. There was a vacancy in the Supreme Court. God help Ruth Bader Ginsburg. She's got to hold on. That woman is like 110. She needs to make it. What happens at the Supreme Court level defines the law for the entire country for generations, potentially, because the Supreme Court doesn't just overturn their precedent, and they don't get that many cases that give them the opportunity to do so. It's a little bit terrifying that that space was filled by Neil Gorsuch, who is a very conservative judge. So what's going to end up happening with this? My guess is this rule passes, or it goes, it's not even a passage, it's just the HHS can do whatever it wants. They're just asking for notice and comment because that's part of the administrative procedure. So they're going to get their notice and comment. Maybe they'll make some changes to the rule. They might make it worse than this. They might make it better. Who knows? But in some form, this is going to go through because this is what Trump promised to do. And you see that there, he thought, my promise is being kept, that he's going to protect the poor, downtrodden, religious healthcare workers in this country who just can't get a break. So this is going to pass in this is going to go through, I keep saying pass, that's the wrong word. This is going to get issued in some version or another. It's immediately going to face challenge. It's immediately going to be enjoined, I'm sure, by the Ninth Circuit. And then we'll see what happens with it. But if it gets kicked up to the Supreme Court, it's dicey what's going to go on. The Hobby Lobby decision, I think, took a lot of people by surprise. It was scary. And we don't have a great composition of the court right now. And hopefully, the people who are there continue to be there, and we don't get another vacancy during this administration, because I can promise you it's not going to be good for any of this kind of stuff. So what can we do about it? Honestly, it sounds so lame, but vote. You have to vote. You have to vote for leaders who support equal access in healthcare. And what I hear all the time from people is, well, I already live in a blue state. So what difference does it make because the people who support this are going to be elected anyway? Great. Still vote for those people, because there are havens now in this country where you can go, and California is one of them, where you can go and actually be sure that your rights are going to be protected. Would it be great if all the people who believed in this stuff lived in Indiana and Michigan and Texas and could also vote for leaders who supported it? Yes. But the fact that you already live in a blue state does not mean that you should not vote for the leaders who support these things. And by the way, it's remarkable how quickly things can turn in any community. You might think you live in a community that really supports something and be surprised. In New York, everybody thinks of as a very, very liberal state. It's really just New York City. And we are constantly faced with candidates who come up that you have to vote against who really don't support this kind of thing, or who take a very middle line on it. So do vote, even though sometimes it seems like it doesn't matter. It does. State laws matter, and local laws matter. And the other thing is, to the extent you can, and it depends, people do this in different ways, talking to people, reaching out to communities they might not otherwise reach out to. But we want to advocate for amendments to existing anti-discrimination laws. And there are legal organizations that do it. There are lawyers like me who do it, to clarify that discrimination on the basis of sex includes sexual orientation and gender identity. And so discriminating on those bases is unlawful. One way that we're doing that in the legal community is outreach to other lawyers. We try to do, because lawyers are the ones who end up becoming judges, and they're the ones who end up going onto the circuit courts. And the more you talk to lawyers about this issue, you can actually make some progress. So we've been holding a lot of conferences and fora to try to discuss this issue and talk about how sexual orientation discrimination and gender identity discrimination is awful for everybody. It should be included under this rubric. There's no reason not to include it under this rubric. If we care about protecting marginalized communities, it's not just women. There's another huge community in this country that has no protection and deserves it under this, because the idea that you could go to your job and be told you're being fired because you're gay, get out, and there's nothing that you can do about that, should be despicable to everybody across the board. What should matter is how good you are at your job. And finally, please support the organizations that bring legal challenges here, because it is a sad state of affairs, but you can do a lot at a grassroots level. But what's going to end up changing the law is these cases that go up to the Supreme Court. And the people that bring these cases are not big companies who have the money to bring them. They are small, there are small individual plaintiffs who get the support of organizations who can afford to bring these challenges to the Supreme Court. So it's Lambda Legal is doing a lot of great work in this space. The Transgender Legal Defense Fund, Lambda Legal is on there twice, that's a mistake, but Lambda Legal. The ACLU and the Southern Poverty Law Center does a lot of good work in this space, despite being in a place that's really very resistant to a lot of this kind of work. So I think the one message that I would hope to instill in everybody is things are dire. These are very dark times. I'm sure everybody feels it. I felt it myself, and it's easy to get very discouraged by it. But there are still things we can do. It's going to take a lot of work. And part of that is the midterms in 2018. People have different feelings about how that's going to go, but hopefully it goes in a way that sends a sort of message to this country. And also, love your lawyers, support your lawyers. They're trying to help you. Not all of them. There's some bad seeds out there, but lawyers are the ones who are going to end up bringing these legal challenges to try to get this access to healthcare. And for you, who are people who are in the healthcare space, talk to people, make sure that when you are, and I think a lot of the theme of the conference today is going to be about ways in which you can, on a practical level, improve access to healthcare and make sure that people from these communities actually feel included and as part of the conversation, and that they're getting what they need from their healthcare providers. That is so, so important on an individual level. So I just want to say thank you for listening, everybody, and I'm very excited to be here, and I hope you all have a wonderful conference. Thanks.